Okay, Dr. Garrow, at what age should a man start getting screened for prostate cancer? And is there an age when screening is no longer necessary?
Sure, that's a great question. Prostate cancer is a very common disease. About 275,000 men, almost 300,000 men a year are diagnosed with
Wow.
prostate cancer. And that's because we do have a test that can detect it at an early age. And that's the PSA test.
Hmm.
Years ago, we used to do DRE, which is the digital rectal examination. And that was not so much a test that people liked.
No.
Nobody really likes it. So the current guidelines really focus on PSA as a test. And so men who are about 50 should really go see their primary care physician or urologist or any other practitioner who screens to do PSA screening. And the guidelines are generally saying that about every 2 to 4 years, a man should have a PSA test.
Oh, okay.
Yeah.
Not every year.
It is feasible to do it every year. Most guidelines give some latitude in the frequency of screening. And that's because the clinical trials that demonstrated benefit had some latitude. And it isn't necessary to do it yearly. Now, there is a situation where a man can have a rising PSA, and then that man would want to have yearly testing. It is very, very important that men have what's called shared decision making with their doctors, meaning that a patient would talk with their doc and make sure everybody understands, especially the patient and family, that PSA is a good test for prostate cancer, but it's not a great test for prostate cancer.
Okay.
There are some false positives, meaning that you can have an elevated PSA without having prostate cancer. So you can have the swollen prostate, which is called benign prostatic hypertrophy, or BPH. You can have prostatitis. That's an infection or inflammation of the prostate.
Hmm.
So there are other, less common disorders that can cause an elevated PSA. But nonetheless, about only 80% of men who have an elevated PSA have prostate cancer. About 20% of people have benign disease. So it's not a great test. It's a good test. And so it's very important to keep